Some of you have been wondering about balloon sinuplasty procedure, and you've been a little on edge and thinking maybe it might work, maybe it might not work. Well, I want to give you a 3D animation of what you have to expect if you're going to have this procedure. Give you some pros and cons and maybe just ease your nerves a little bit if you do have to go through this procedure. A lot of you are already aware you've tried many things and nothing seems to be working. No medication, no remedies, things that you've tried by your doctor or things you've read online, and it's really at the point where you're at a crossroad. So I'm going to go into some 3D animation, show you what it looks like, and hopefully if you are at this point, this is going to calm your nerves for you. Balloon sinuplasty is a minimally invasive procedure. It's used to treat chronic or recurrent sinusitis or sinus infection. It involves inserting a small balloon through the nose to dilate the sinus openings, allowing for better drainage and relief from symptoms. The procedure is typically performed under local anesthesia and has a quick recovery time. It does not require incisions or implants and has a low risk of complication. Some of you are really at the end here and you need to try something that's going to help open those sinuses. As you can see here, the patient is lied down here and it's going to go through the process. After the local anesthesia has been given, next is nasal passage insertion. A guide wire is inserted through the nasal passage and guided to the sinus cavity. Balloon insertion. A balloon catheter is inserted over the guide wire and positioned in the blocked sinus passage. I've been told many times that my sinus passages are very, very narrow. In fact, most of the time when you go in having symptoms of Eustachian tube dysfunction and tinnitus, you're probably told that as well. You're probably told there's fluid buildup or there's too much congestion, and then you're put on nasal spray. Let's move on to the next step here. Balloon inflation begins. The balloon is inflated, gently dilating the sinus passage and removing the blockage. So remember, those that have had problems with Eustachian tube dysfunction and tinnitus, initially there may have been an issue with your sinus region. Could have been sinusitis, it could have been allergies, yes, it could have been a cold. But now with Eustachian tube dysfunction, it moves into more of a muscular issue or a structural issue. But initially I would say it can fall into the issue of sinuses and stay there as well. Let's move on to the next step here. Let's just call this step 5, sinus cavity dilation. The balloon is left inflated for a few seconds to allow the sinus cavity to dilate. Again, this is really going to help with the airways. It's going to help with breathing. It's going to really enhance your overall experience with your sinuses that you probably lost through some portion of the time here. And then at some point when your sinuses start to decrease, you get into this position right here. Again, if you're dealing with Eustachian tube dysfunction or tinnitus, and it's a structural or a muscle issue or a posture issue, don't expect this procedure to heal all of it and correct all those things. You got to keep in mind, if you're dealing with Eustachian tube dysfunction again, or patulous Eustachian tube disorder, this is not going to help resolve any of those things if it's a structural or a muscle related issue, or something brought on by stress, or something brought on by your poor posture. You got to keep those things in mind. But if you have sinusitis issues or sinus issues in general, this is really going to help resolve a lot of those problems. One of the trickiest parts about deciding for this procedure is that you don't know exactly what's causing all of your symptoms. A lot of you are dealing with the clogging, the clicking sounds, muffled sounds, vertigo, all sorts of things. But as you can see in this procedure, it's really going to be identifying issues with the sinuses and issues with pressure buildup due to sinusitis and problems of that nature. I ultimately opted out of this procedure because I was fortunately enough that I found out that for my particular issue was more structural, more of a problem with my jaw. I was getting a lot of clicking sounds, but it was leading up to a lot of my issues with my TFJ joint. You know, it's at this point that the balloon is inserted and dilating, and this is when your sinus region is taking form. The entire procedure usually takes about 30 to 60 minutes. And I've heard and seen through other people's recovery that this has been a great thing that they decided to do. I personally have not gone through it myself, but I've done a lot of research and I've talked to many people that have had it done and they feel much better. And to step 7, sinus irrigation. The sinus cavity is irrigated with saline solution to remove any remaining debris. We build up so much debris, mucus, and congestion over time that we need to have our sinus irrigated, no matter if we're dealing with this problem or not. I recommend, my humble opinion, to use a neti pot. It's very safe, very easy to use, very basic. It can clean out and flush your sinuses. And I recommend, even especially during the time when spring is around or winter season, you should do this a lot more often. But just on an overall basis, it's like any part of the body. You need to flush it out and clean it every so often. And your nasal passages are no different. So in my humble opinion, I would do it at least once a month. Go through, if you're not dealing with any problems, once a month, flush out your sinuses, get a nice good fresh coat going on there, get the saline, flush it out. And that way, even if you're not dealing with anything, even if you're not symptomatic, this is going to help overall your entire body. Believe it or not, your entire body. It's going to help flush toxins out. It's going to help flush the bacteria out. It's going to help flush mucus and anything that's remaining just out of your sinuses. So as a preventative measure, even after procedure is over, I would recommend doing that as well. But of course, you want to stay in touch with your doctor or whoever's doing the procedure to keep in mind that they're going to know what's best for you. Let's talk about the pros and cons of the procedure. So let's start with the good part, the pros. It's safe and minimally invasive. Few complications, relatively quick procedure, 30 to 60 minutes as I've stated, can be performed in a medical office or hospital operating room. Does not require incisions, typically does not require an overnight stay in the hospital. Recovery time is relatively quick, up to 3 weeks, and has a high success rate, 91.6% according to a study. Now let's discuss the cons of the situation here. May not be effective for all types of sinusitis. For example, sinusitis with nasal polyposis may not be effective if the sinuses are not the source of the symptoms. Some patients may experience a return of symptoms requiring additional procedures. May cause acute bacterial sinusitis, excessive bleeding, changes in sense of smell and taste, or injury to the eye socket or contents. Requires a CT scan to confirm appropriateness of treatment. Requires preparation, including stop and start medications and supplements. Requires follow-up appointments to ensure healing. So again, the pros list and the cons list is about the same length, and it's really something you're going to have to weigh out how you feel overall, how your lifestyle is going. Is it something you can manage, just maybe treating it the way you were trying to treat it, continue doing that? Or is this something you just need to go ahead and do because everything else is simply not working? That's something that I'll leave up for you all to decide and your doctor. But in the meantime, I'm just here to bring the source of information and education. And hopefully this helps you decide on what you want to do in the future. So overall, I hope this video was very helpful for you. In the meantime, I'm going to go ahead and step out of the J1 studio and leave you in good hands with this video. Like anything else, folks, we're here to simply go back to the basics. Take care, everybody. Talk to you soon, and happy healing.